begin. We can go ahead and get started into our policy webinar for today, Fall into Action 2025. Thank you all for joining us today. Aman, if you wanted to go ahead and go to the next slide. All right, so we do have Spanish interpretation for today's webinar. If you wanted to join it, I just wanted to thank our fantastic Spanish interpreter, but to join it, you can click the interpretation icon at the bottom of your Zoom. And if you would like to listen to in Spanish, and then at this moment, I would like to give Alejandro a time to do the Spanish version for those who need Spanish interpretation.
Hey everyone, I'm just going to go through the instructions for Spanish interpretation. Hola, buenos días, buenas tardes. Muy rápido les voy a explicar cómo activar la interpretación en español. Si es que están en una computadora, en la parte de abajo de la pantalla van a ver un globo, un icono de un globo que dice interpretación. Le dan clic al icono y luego español. Si no ven el globo, van a tener que darle clic a los 3 puntos que dicen más y luego interpretación y luego español. Desde un celular, iPad, tablet, es más o menos lo mismo, pero uno tiene que tocar la pantalla para que aparezca el menú en la parte de abajo. Y luego deslizas buscando los 3 puntos que dicen más, le das clic, luego buscas la opción de interpretación, y luego español, y luego le das clic en la parte de arriba donde dice algo como listo o finalizar. Cualquier cosa me pueden comentar y yo les ayudo. All right, take that.
Thank you so much, Alejandro. Now I will be passing it on to Angela to welcome us into Fall into Action.
Good morning. Thank you for joining us today on this Veterans Day. I wanted to start by just thanking our veterans and our military families for all you do in service of our country. I am Angela Farwig. I am the Vice President of the Public Policy and Advocacy and Research Team here at Illinois Action for Children, and I'm really happy to welcome everyone to this year's Fall into Action, Illinois Action for Children's annual fall workshop, where we share the latest information on the state and federal early childhood policy landscape. We highlight innovative research in the child care field. We preview some of our legislative priorities for the upcoming legislative session. And most importantly, we hear from all of you about your experiences, your ideas, and what you think we need to know to make sure we are supporting children, families, and the entire early childhood field. Before we jump into our content, I did want to take a moment to introduce all of our team members to you. And so I am just going to take a minute or two to call out the members of our team here at Illinois Action for Children. I already introduced myself to you. I'm Angela Farwig. Right now we have Michael Kim, our Director of Public Policy, who will be guiding us through our webinar today. We also have Bree Stormer on the team, who works on a lot of our policy and engagement work. If we go to the next slide, we have Marcia Stoll on our research team, Crystal Salas, who is our policy associate, Celia Bartel, our advocacy and engagement associate. Hopefully those folks are waving as I call their names. Aman Kapadia, our public policy research and advocacy project manager. Thank you, Aman, for all the support today. Arunima Marotra on our research team. Alejandra Flores on our research team, who we'll be hearing from later today. And finally, we also have David Alexander, our Director of Research, and Naoma Nagahawata, our Assistant Director of Advocacy, who supports the We the Village Coalition. So just want to take a moment. That's the team. We're really excited to be here with you today. And as we start, we did want to start with an icebreaker. So if folks would like to put their name and who they're representing today in the chat, we would really appreciate that. And if folks want to share what they are grateful for at this moment, as we approach the holiday season, and also just take a moment, given everything that's going on, to pause and think about what we're grateful for. I will share that I am grateful for my community on the north side of Chicago, where I live in the Edgewater neighborhood. Give folks a moment. Thank you, Kimberly. Kimberly is grateful for her family. Adriana, grateful for family, friends. Grateful for extended family and warm blankets. Yeah, seeing lots of thanks for our friends and family. So important. Our community. Lori, thanks for being here. Grateful for that shutdown. We'll talk more about that coming up. opportunities to connect. All right, well, please keep sharing in the chat. I know we have a lot to talk about today, but thank you again. We're grateful that you're here with us today. And I will turn it over to Michael Kim to go over our agenda.
Thanks, Angela. Hey, everyone. Good almost afternoon. Like Angela said, my name is Michael Kim. I'm the Director of Public Policy. And I always like to start off with Fall into Action by saying this is going to be the best 2 hours of maybe your day, maybe your week, maybe even your month. So hopefully you guys are ready to get into and dive into some legislative work, updates, and work we were planning to do for the next year or so. So as you can see in the agenda, there's a lot to cover. We're going to start off with some election updates. Many of you guys know midterm elections is coming up. We want to share what's on the ballot, who is up for re-election, who's running for different seats. After that, we're going to go over some federal updates. We're going to hear from Jamie from the Greater Chicago Food Depository on some of the SNAP updates that we have currently, and then we're gonna hear from Lori with the Illinois Head Start Association on some Head Start updates as well. And then there's some bills at the federal level that are currently being discussed and talked about. So we'll update you guys on those as well. And then we're going to go over to some of our FY27 legislative and budget update, and then give you guys some information on what happened during veto this past October. After that, we'll transition over to a great presentation from our research team member, Alejandra, on non-traditional hour childcare. And then we'll obviously give you guys a little quick break. And then after break, we're going to come back and look at some of the work that we, as Illinois Action for Children, are doing with the Department of Early Childhood around family, friend, and neighbor work. After that, we're going to do something a little bit different. We're going to have a larger discussion on some of the FFM work, and then we're going to break into smaller groups to talk about some additional work that IDAC is doing around workforce redesign and workforce improvements in the field. And then after that, we'll share out, and then have closing remarks from everyone, and that would be the end of our webinar for this year. I am going to now pass over to Crystal, and we will get this started with some election and federal updates.
If you can go to the next slide, Amon. Hello, everyone. As you know, we are in the month of November. Many states did have elections this year. Illinois was not one of those states, but we are heading into an election year for the year 2026. So we will be heading into the midterms. The Illinois primaries will be Tuesday, March 17, 2026, and all 17 of the Illinois U.S. House seats will be up for election. One of the 2 Illinois U.S. Senate seats will be on the ballot. All 118 seats in the Illinois House will be up for election, and at least 2/3 or 39 seats in the Illinois State Senate will be up for election. And if you aren't registered for the upcoming elections, we do encourage you to go and register. We do have some guidance on how to do it here on this slide, but we can go ahead. We will be sharing out the slides after this presentation, which you will be able to go into it and click on the links. All right, we will now be going into federal and state updates. Okay, as many of you know, on October 1st, the federal government began a shutdown as Congress was unable to reach an agreement on a continuing resolution or a funding bill for the fiscal year 2026, which meant that many essential programs were at risk. This Sunday, November 9th, the Senate advanced a legislation that would end the government shutdown. In this legislation, funding would go until January 30th, 2026. Funding for SNAP would be guaranteed until September 2026. However, we are still currently in a federal shutdown. We're currently on day 42. The federal government has yet to open, as this legislation still needs to go to the U.S. House of Representatives. And at the moment, there is no expected votes for the date of today, as it is Veterans Day. But things could change. But at the moment, there is no expected votes for today. And then as well, there was recent federal legislation that was introduced on early childhood, which is good news. There was the Early Childhood Modernization Act and the Head Start for America's Children's Act, which we will go into further into this presentation. But at this moment, we will be going into federal impacts, where we will be going over SNAP and Head Start and WIC. So I will now be passing it on to Jamie Holiday, if you're here. No, oh, I'm sorry. I believed, I thought sorry about that. So we'll be going over the Child Care Modernization Act. So a group of bipartisan senators introduced the Child Care Modernization Act that would strengthen the federal child care and development block grant, also known as the CCDBG. So the CCDBG hasn't been reauthorized since 2014, and the Child Care Modernization Act will reauthorize the CCDBG, which is the primary federal grant program that allows states to provide child care assistance. So the purpose of this bill is that it will modernize how the system works to respond to current challenges that many of you see in the field, like workforce shortages, rising costs, and serving underserved areas. So a little bit more about what this bill does is it switches how states set payment rates to childcare providers. States will design a cost estimation model to calculate provider payment rates, leading to more accurate and reliable estimates. New child care supply and facility grants, new grants that would help providers meet health and safety requirements, licensing and other regulatory standards, such as improving facilities and to serve more children and families. We can go ahead and go to the next slide, which is Head Start for America's Children Act. So as many of you seen, there has been a lot of recent attacks on Head Start. And to ensure that children continue having high quality early childhood education, Head Start for America's Children's Act was introduced. So what this bill hopes to do is that it seeks to authorize full funding for Head Start by providing nearly $145 billion to make it available for all eligible families. It also aims to simplify the enrollment process. It will expand grant funding to allow programs to work with parents' schedule and to stay open longer and for the full year. It addresses the early childhood education workforce shortage by raising salaries for Head Start educators and staff with competitive benefits and salary scales. As well, it creates a Rebuilding Head Start workforce grant program that will address retention through recruitment bonuses. It also provides mental health support for staff, families, and children, and it creates a co-location partnership with colleges, campuses, and other child care providers. Go ahead and go to the next slide. And now we will be going into federal impact. So I do want to welcome Jamie Holiday, who from the Greater Chicago Food Depository, who will tell us a little bit of updates from SNAP and WIC.
Hi, good morning. Can everyone hear me okay? All right, perfect. My name is Jamie Holiday. I am one of the policy directors at the Greater Chicago Food Depository, and I'm really excited to share some updates on what's happening at the federal level regarding the SNAP and WIC programs with you. Before I dive in, I just want to thank everyone on this call for your commitment to early child care and education. As you all know, we all have a role to play in building positive outcomes for children and their families. And so, yeah, I'm grateful to have this space and to join you today. At the Greater Chicago Food Depository, we're committed to ending hunger by connecting our neighbors with healthy food and advancing solutions that address the root causes of hunger, and ensuring that every single child has access to nutritious, quality, and affordable food, no matter where they come from, is essential to providing them with the most basic building blocks they need to grow and thrive. So the SNAP and WIC programs are two vital nutrition assistance programs that children and families rely on to help meet their most basic needs. So I'll start by talking about HR 1, which is also widely called the One Big Beautiful Bill Act, and the changes that it made primarily to the SNAP program. And then I'll get into some updates on the federal government shutdown. So HR 1 was signed into law on July 4th of this year, and it made the largest cut to SNAP in history, cutting the program by almost $200 billion and removing millions of people from access to food assistance. The bill specifically increases the amount that the state is required to cover to administer the program both in terms of the cost of benefits as well as administrative costs. Prior to HR 1, the federal government covered 100% of benefits for participants. Under the bill, now states have to pay between 5 and 15% of benefits depending on their payment error rate. And I just want to note that the payment error rate is not actually a measure of how well we do necessarily administering the program, but they're mistakes that are largely unintentional that either the state government or participants make when they're applying, simply as making a keystroke error and entering the wrong number. And so states will now be penalized for that by paying a greater portion of benefits. Previously, also, the state would cover 50% of administrative costs, while the federal government paid the other half. Now, states will need to pay 75% of administrative costs. Between both the cost of benefits and administrative costs, Illinois will need to pay up to $800 million per year to keep the SNAP program intact for those who need it, beginning in October 2027. Another thing that the bill does is remove SNAP benefits for many legally present immigrants. Immigrants that previously were able to access SNAP included refugees, asylees, certain victims of human trafficking, and certain victims of violence, and now they are not able to get access to the program. The bill also expands work requirements by requiring some previously exempt groups, including veterans, individuals experiencing homelessness, youth aging out of foster care, and older adults between the ages of 54 and 65 to meet the work requirements. So previously, they did not have to be subject to work requirements or in order to receive SNAP benefits beyond 3 months in a 3-year period. Now they have to meet those work requirements if they want to have continued access to SNAP benefits. It also requires caregivers who have dependents 14 and older to meet the work requirements. Previously, if you had a child who was between 14 and 18, they would also be able to be exempt from the work requirements. It also cuts SNAP by preventing future increases to benefit amounts. So when there's food inflation like we're seeing now and really high grocery prices, SNAP benefits won't be able to be adjusted to help families pay for that increased food, that increased cost. It also narrows the state option to calculate utility deductions, which increases participants' net income, which means that they have more income, which means they're now eligible for a lower benefit amount. And the last thing that HR 1 does with SNAP is that it eliminates SNAP nutrition education, also known as SNAP Ed, which provides really helpful education to households on how to prepare meals using their benefits and safe preparation, and also things like cooking classes and able to fund community spaces where folks can come together and learn about their benefits and how they can use them in their communities. So for WIC, HR 1 did not make the same changes, but it did make some changes to how participants can access WIC based on adjunctive eligibility. So adjunctive eligibility means that a lot of families qualify for WIC by proving their participation in other income-tested programs like SNAP and Medicaid. And due to the changes that HR 1 made to SNAP and Medicaid with these work requirements and the way that eligibility is determined, that means that families don't have the same simplified access that they would normally have to access the WIC program. And by making families provide an alternative proof of income for WIC, there's an added administrative burden that could delay access to the program or discourage some families from accessing the program services. So those are the impacts to SNAP and WIC with HR 1. And now I'll talk a bit about the shutdown. As Crystal mentioned, the shutdown began on October 1st after Congress failed to reach a deal to fund the government past the end of the fiscal year. To date, legislation has not been passed by both chambers to reopen the government. And so the federal government shutdown has had significant impacts on SNAP. October benefits went out as regularly issued because states already had provided funding for the usual process. Usually states prepared to send benefits in the middle, around the 15th of the previous month for them to go out the next month. So they were prepared in September to issue October benefits. But to date, participants have not received full benefits for November. They have only received partial benefits. And there has been a lot of action that has been around these November benefits. On October 10th, the federal government, the USDA Food and Nutrition Service, instructed states to pause their issuance of November benefits until they received further instruction. And then a few weeks later, on October 24th, USDA said that it would not provide states funding to issue November benefits unless the federal government reopened. They argued that they did not have the legal authority to use their contingency fund for the SNAP program, which a lot of anti-hunger advocates have agreed is the actual intent of the contingency fund, to be able to tap it when there's insufficient funding for normal benefits. So there were 2 lawsuits that were filed in direct response to this. There was one in Massachusetts, filed by 26 states, and one in Rhode Island, filed by national nonprofit organizations. And on October 31st, the judges in both cases said that USDA had to pay at least partial benefits for November using the contingency fund. And they also had the option to supplement the remaining cost, since the contingency fund would not cover the full cost of benefits. They could make other funding available to make up for full benefits. USDA chose to cover partial benefits for November. On November 4th, the department issued guidance instructing states to allocate benefits based on 50% of the maximum benefit. And then the following day, it issued revised guidance that said that states could issue 65%. So a 15% increase to 65% of the maximum benefit, which meant that households would get a little bit more. And then Thursday of last week, on November 6th, the judge in the Rhode Island case issued a ruling that ordered USDA to pay full benefits by last Friday. The Trump administration appealed this almost immediately, and on Friday, the Supreme Court granted the administration's appeal to temporarily block the court order to fully fund the benefits. So this litigation is ongoing as of today. So what we do know, though, is that SNAP households will receive their full benefits either as a result of this litigation ending in a decision that says that they have to pay the full benefits, or when the government shutdown ends. And so what that means for Illinois is that to date, most SNAP households should have received 1 or 2 payments as of now to make up for their partial benefits based on when IDHS processed their payment. It's important to remember that if there are any SNAP participants or neighbors that have leftover benefits on their EBT card from previous months, they can still use those in stores today. And eligible people should still be applying for SNAP, even if the government shut down. IDHS is still working, and they're still working on applications and processing, so folks should still continue to apply. The shutdown, so that was SNAP. The shutdown has not equally impacted WIC. Like SNAP, WIC benefits went out regularly in October. For November, USDA agreed to fully fund WIC using the program's contingency fund, as well as reallocating unspent fiscal year 2025 funds. And it also provided $300 million from tariff revenue, which were put into Section 32, which is basically a for lack of better terms, it's a slush fund that the department can pull from. So it's not clear. So WIC is fully funded for November. It's not clear what will happen to either program if the shutdown were to extend beyond this month. And so those are the federal updates regarding HR1 and the shutdown. On your screen, you have our QR code to join our advocacy center. If you scan the QR code, you'll be able to sign up to receive our monthly policy newsletter, action alerts to contact your elected officials, and invitations to our policy learning webinars. You can also visit our website at chicagosfoodbank.org to find additional ways to take action, or if you're in need of food assistance and you need to find somewhere to get food. And lastly, we would love to keep in touch with you through the Illinois Action for Children to share any updates that we have on policy, on outreach, and how we can work together to continue to support families in our communities. So I really appreciate the opportunity to join you today. I will have to leave the call a little early, but Crystal has my email. So please feel free to follow up with me if you have any questions about anything covered today. Thank you so much.
Thank you for joining us, Jamie. We will be now welcoming Lori, who will be giving us some Head Start updates.
Great, thank you, Jamie. I know that it's just devastating. You know, a majority of our families and children access SNAP and WIC, of course. So we're behind you. So I would just jump in and let you know that some basic information first, because we've get a lot of questions around how this impacts Head Start. So remember that the federal fiscal year begins October 1st and ends September 30th. I think that's a key thing that people miss. Other questions we get are that why are some programs closed and some programs open? So basically, Head Start funding is based on their fiscal year, and our Head Start programs have different start dates to their fiscal year. So some may have an October 1st start date, some may have a November 1st, some may have a December 1st. So it just depends which bucket they're dipping out of. You can skip this first slide, and we'll go to the second one. So Illinois did not have any October 1st grantees. And so thank goodness that we didn't, but other states did. And so when you get to October 1st, you're beginning to dip out of that FY26 funding, which we have no budget for, or no Congress can't agree upon, you know, the funding moving forward. So, and, you know, then we get to November 1, you know, and so those November 1st grantees begin to dip out of the FY26 budget. And so that's why, you know, some programs are still operating under FY25 funds until they get to the beginning of their fiscal year. Then they operate out of the new budget, the FY26 funds. So the next slide will tell you a little more about Illinois specifically. And so, you know, all of our Head Start, Early Head Start programs remain open. As I said, we didn't have any October 1st grantees fiscal year beginning on October 1st. But we did have one who is our only sole November 1st grantee, and that was one of our programs down in the southern part of the state. Although if we went much further, we would have had 3 large Chicago grantees beginning in December. So we have been pushing this forward. So how did our November 1 grantee stay open? They had a small grant from the community service, the state community services block grant reserves, state reserves that provided them a grant fund so they could stay open, and they mixed that with some of their reserves they had on hand, and so they're up and running and still providing the same services that they did in the past. But the tricky thing here was in our past, we were always able to take out, a small loan and low interest loan or interest-free loans. But this administration made it clear that maybe they wouldn't pay back to the beginning of your fiscal year. So it made a fiscal risky for operations for your program to take out a loan because you didn't know if you were going to be paid back or not. And that has never happened in our history. So we'll go to the next slide, and I can share a little bit more about staff. We get this question a lot, well, are Head Start staff federal employees or not? And so they are not federal employees, but their salaries come from the federal grant they receive from the federal government. So when programs have funding, they can continue to pay their staff. And then all of the services stay in, the family services and the educational piece continue to move forward as long as there's funding. So that's exactly what our November 1st program did, is they used funds from the state, a small grant, and their reserves to stay open. So the next slide gets into a little more detail. Some of this has already been shared. So last night, the Senate held a series of votes and they passed their final version and now sent it over to the House. And we know that Speaker Johnson now has called back all the House members who now will take what the Senate sent them and hopefully pass that version, and we'll be back open as a government. And this could happen as soon as tomorrow, but potentially on Thursday for sure. They have 36 hours before a vote on the floor could take place. So the CR is good through January 30th. And then we know it's the same level of funding as we had last fiscal year. So it's going to be really hard in our world to survive without any COLA, cost of living raises, or any other additional funding. It's funny because we asked for a small increase of 85 million this year. We couldn't even get an 85 million increase. And it was part of the Senate version that came out during the summer. But then the Senator Bernie Sanders bill that was mentioned earlier was 145 billion. We love that bill, but we knew that wouldn't go anywhere. So, but at least it's a marker in the sand that we can build towards. What was important here is the legislation that was in what the Senate passed says that we can use expenses to go back to the beginning of our fiscal year. So this means that our November 1st grantee can go back to their November 1 date and get their full funding. So that'll be really nice. And then Jamie's already mentioned that the information on SNAP and WIC. And we know that the legislation that was moved out of the Senate did not include those healthcare subsidies. And so this is disheartening because families will be tough paying for their health insurance. But also, that those federal employees, including the Office of Child Care and the Office of Head Start, were laid off. And so the legislation ensured that they would receive their back pay and reinstate those staff that were RIFed. So that's really important to our world because what happened was the administration RIFed everybody in the Office of Community Services, the Community Services Block Grant. And that was devastating because this is important to our communities across our state. And so the Senate version did reinstate the staff in this office. So that was a really good thing that was included in what was passed out of the Senate and now moving towards the House. So I'll do I think, is there one more slide? No, this is it. So I'll end here, but the only thing I would add is that just because the government opens this week doesn't mean that our funding begins to flow immediately. What needs to happen is the Office of Head Start needs to get out those notice of awards and that'll take probably 2 weeks to do. So we've really could use advocacy support on reaching out to congressional members and senators to tell them, get those we need to lean on the Office of Head Start to get those notice of awards out to that November 1 grantee we have in our state and also our December 1st grantees, because we can't draw funding without that notice of award. So those are extremely important.
Thank you so much, Lori, for these updates. I believe Jamie is no longer on this call, but if anybody had any Head Start questions for Lori, we do open up the chat at this moment for that.
And also feel free to come off mute if you want to just ask a question directly.
Okay, I believe we don't have any questions at the moment, so we can go ahead and move to the next session. So I do welcome Michael to join us in for the veto session. And if you had any questions in regards to SNAP or WIC, I will be putting Jamie's email in the chat. And Lori, if you wanted to, feel free to put your email as well.
All right, thanks, Crystal. Thanks, Jamie and Lori again for such great updates. We really appreciate you guys taking the time to share what is going on in your neck of the woods as well. So I'm going to move us along to some updates from what happened in veto this past October, and then we'll go over some of our federal FY27 budget priorities as well as our legislative priorities. So first, this I think is hard to say that everyone has seen what happened this past week with Diana and our members of our community being attacked by ICE agents, and it's really hard to see. And to be honest, this bill was not. We have foresight in terms of wanting to make sure none of this craziness goes into our field, but we just wanted to protect our community and the folks who work in the early childhood community, to make sure that if this did happen, that they would have some sort of right and protection for their staff, their family, and obviously, most importantly, the children. So I just want to say that before going into the bill that we're talking about. And the bill is HB 1312. It's a comprehensive civil rights litigation, a package of bills that will create safe spaces in and around Illinois, mainly in courthouses, hospitals, Institute of Higher Education, and then obviously our licensed childcare programs. This is just making sure that there is guidance and information sharing within our providers to their staff and to their family. It will require that no licensed childcare centers will be excluding or discouraging families from participating in daycare program based on their actual or perceived immigration status. It will require them to adopt some certain policies and will make sure that these policies are enforced in terms of making sure that children and families are safe. The policies and what licensed childcare centers are required to do in this process are listed, so I won't go in depth into that unless there's questions at the end. But we just felt that this again, we didn't feel that this was going to happen, but we were glad that now we do have some sort of protection for our providers and for our families and children who attend our programs. One last thing I will say is this bill has not been signed by the governor yet. From our information, is being given over to the governor's office shortly, and he will most likely sign it. And then the effective date of all the policies that will go into place will be January 1st, 2026. So about a month and a half from now. So let me pause there, and then actually no, I'm sorry. Let me go into our federal budget and legislative priorities, and then I'll take questions afterwards. So next slide. So as new session starts and new fiscal year is upon us, we as advocates always have specific areas of need and specific budget asks that we will be asking the governor's office as well as the General Assembly. So these next 4 slides will be focusing on those areas. First, we are going to be asking for a $120 million increase to the Child Care Assistance Program. This is mainly to keep up with the maintenance and just the caseloads that we predict that will happen in the next fiscal year. We're estimating around a 4.5% increase into the CCAP caseload for FY25, which is part of what the $120 million increase will go to. Along with that, accelerate quality add-on rates. The 4% reimbursement rate increase for home-based providers through the SEIU Healthcare CBA agreement that they have with the state. And then what we included in our budget was a 3% reimbursement rate increase for center-based programs as well. As many of you guys know, when SEIU did their CBA, the DHS did not have a parity rate increase for center-based programs. We feel that having parity rate for center-based is important and in terms of providing high quality and making sure that teachers are paid a livable wage as well. So this our budget will include a 3% reimbursement rate for center-based programs. Next. And on top of that, we will be asking for a $50 million increase for Smart Start workforce grants. This will be to make sure that funds will raise the wage floor for assistant and lead teachers. We feel that there needs to be some sort of market rate wage increase for the grants that are being provided through Smart Start workforce grants. What this will do is increase assistant teachers' wages by 25 cents per hour, and then lead teachers to $2.50 per hour as well. And again, this is to make sure that we are in terms of in line with the market rate. And from what we've gotten data from IDHS and other information, this will go into this raise will go into the market rate that we expect it to be for specific regions. Next, we'll have a $5 million increase for home visiting. Again, this is a very modest increase that is part of the governor's Smart Start Workforce Initiative, and increased compensation, and it will definitely to support essential infrastructure for home visiting program. Next slide, please. The next 2 areas that we want to focus on is the Early Childhood Consortium for Early Childhood Access Consortium for Equity scholarship, which will hopefully get a $5 million increase for this ECA scholarship that we have been getting for the past couple of years. Ever since we created this program, we had a lot of COVID money that went into it. Once the COVID money ran out, the state was only able to provide a $5 million increase for the scholarship for the last 2 years. We're hoping to get an additional $5 million increase to hopefully make sure that there is enough money to help those who are closest to completion in terms of their studies and their program to be able to finish what they started, and then hopefully get enough to have a new cohort of incumbent workers to be able to come into the program and move along with their educational process. And then on top of that, we have a $40 million increase for the early intervention program. This will provide recruitment and retention efforts for skilled professionals and therapists. Hopefully, it will reduce caseload as well, and then strengthen referrals and intake processes for the EI program. Our friends and partners over at Start Early have been doing a lot of advocacy work on this, so we will share some of the work that they have been doing, and then ways for you all to get involved in some of that work as well. And then last budget update we have is around Early Childhood Block Grant. Again, this is part of Governor Pritzker's Smart Start initiative. For 4 years, he was committed to doing a $75 million increase to the ECBG budget. Unfortunately, last year, there was a tight budget session and tight budget year, which prevented him from providing the $75 million increase into ECBG. We will be working with the governor's office and the General Assembly to hopefully reinstate the $75 million increase for this year at least. And then hopefully that will go towards our early childhood block grant and to the commitment that Governor Pritzker has had in terms of creating more PFA and PFAE slots for and around early childhood slots in Illinois. That is a very quick budget update for you all. Last thing that I want to talk about is our legislative priorities for Illinois Action for Children for the coming FY 27 session, or fiscal year 27 session. So we know that insurance premiums and insurance costs have been going up rapidly for many providers, if not all providers. We know that this is an issue not just in Illinois, but across the country. And we want to know where we can minimize some of the costs and some of the issues that are currently happening. That's why for this coming session, we will be focusing on a bill that will help direct the Department of Insurance along with hopefully IDAC to do a survey and to really understand where these premium rises are coming from and help us figure out a legislative solution for the following veto session or maybe the following session on how we can solve this. So the very simply put, this survey and this report will just have some information on where the liability insurance has gone from in the past 5 years, the percentage of increases for providers, and what coverages folks have been able to get, not been able to get, if they've been dropped by insurance companies, and so on. We're just hoping that, as we gather all this information, that we can definitely have a more robust data into providing a real solution that we can help childcare providers either lower their premiums or make sure that they get access to high quality insurance policies and making sure that they can find policies as well. So that is the main bill that we'll be working on and we'll be focusing on for FY 27. And the reason we're doing this one specific bill right now is because we know that the Department of Early Childhood is focusing on some of their legislative priorities. We know that 2 main areas that they're going to be focusing on is licensing reform and funding redesign legislation. As we learn more about these 2 legislative priorities from the Department of Early Childhood, we will definitely work, figure out where they will prioritize some of their areas of focus. And then from there, we will obviously, if we need to pivot and make sure that there are some other areas that we need to focus on, then we will move into that direction. But until we find and see this legislative priorities from the department, we are holding off on some of the other areas that we want to focus on legislatively for FY 27. Legislative session. So I will stop there. I know that was really quick, but it was due to some timing constraints. So I will stop there. If there's any questions around the budget, legislative priorities, or veto session, I'm happy to answer them. So I'll leave it open for a couple of minutes until to see if there's any questions. All right, if there are no questions that are pressing, I will pass it over to Alejandra to do her presentation on non-traditional hour childcare. If you guys have questions, feel free to put it in the chat and I will make sure to answer them as I go through the chat. So Alejandra, hand it off to you.
Okay, thank you, Michael. Hello, everyone. My name is Alejandra Flores, and I am an analyst with the research team here at Illinois Action for Children. And today I'll be presenting on our findings from our provider survey on childcare during non-traditional hours. So to begin, I want to do a quick definition of non-traditional hour childcare as we defined it in our survey. So this is any childcare that takes place outside of standard daytime weekday hours and includes childcare during early mornings before 7 a.m., in the evenings after 6 p.m., overnight between 11 p.m. and 4 a.m., and on weekends, anytime on Saturday and Sunday. And for our survey, we had several research questions that we wanted to answer. If you could just press on the animation, Aman, thank you. So the questions that we wanted to answer in our survey were, what are the characteristics of providers that offer non-traditional hour childcare in Illinois? How do childcare providers enact quality during these hours? What are their experiences and challenges in offering this care? And what are the reasons why providers choose to offer or not offer non-traditional hour childcare? And what supports do providers need? And we can go to the next slide now. So for our survey, which we conducted back in March of 2024, we had 434 providers who responded across 66 counties in Illinois. And we heard from both providers that offer at least one non-traditional hour schedule and also those who only offer standard hour care, because we wanted to be able to compare these two groups. And we had a pretty diverse group of providers who responded, although the majority did have 10 or more years of experience working with children. We had a pretty good demographic breakdown, and we also heard from 3 different provider types. So we had 40% of our respondents who were licensed family childcare homes, 35% that were family friend or neighbor providers, and 25% who were center directors or owners. We can go to the next slide. So in the next few slides, I'll be presenting some of our findings on who offers non-traditional hour childcare and what do these providers look like and the schedules that they offer. So to begin, we asked providers for the hours that they care for children, and we wanted to know what non-traditional hours they were offering. And we found that home-based providers, both FCC and FFN, were more likely than centers to offer non-traditional hour childcare. Centers that were offering non-traditional hour childcare tended to only offer early morning care, although there were a few that offered some of the other schedules. And for FCC providers, they were most likely to offer early morning and evening care. Interestingly, FFN providers were most likely to offer overnight and weekend care, which is some of the hardest care for families to find due to the lowest supply of this type of care. And we found that FFN providers also tended to offer the most variable hour care, where if parents needed care during where their hours changed day to day or week to week, and also drop-in or emergency care, FFNs were most likely to offer this, and they offered the most flexibility for families who needed this care as well. Next slide. And another interesting finding was that we found that 85% of providers that are offering non-traditional hour childcare are doing so in addition to standard hours. So providers are working extremely long hours. If we can press the slide again, we found that non-traditional hour childcare providers work an average of 14 hours per day compared to 10 hours per day worked by those who offer only standard hour care. And this was an important finding because it highlights that already the childcare workforce is working very long shifts. And when we're asking providers, if they're working non-traditional hours, they're working even more so. 14 hours per day is an extremely long day. We can go to the next slide. And some of the interesting characteristics that came up when we compared provider demographics, we found a few that were statistically significant differences between non-traditional hour and standard hour only providers. So we found that Black providers ages 55 to 64, and large centers that care for 100 or more children are more likely to offer a non-traditional hour schedule than only a standard hour schedule. And this may be due to demand for these providers or feasibility as well. Next slide. In this next section, I'll go over some of the unique qualities of non-traditional hour childcare that providers shared with us. So to begin, we asked providers about how each of their schedules differed from a typical standard hour day to see if early morning, evening, overnight, and weekend care was any different. And we found that overall providers shared that they typically had fewer scheduled activities and were less focused on curriculum during these hours. Instead, they were tailoring their care to meet the unique needs of children during these hours. So for example, during early morning care, providers were sharing that children usually arrived sleepy or wanted to go back to bed, so they would either let them rest until breakfast time or allow them some quiet free play while the other children slept. During evening care, children were again winding down for the day. They were usually tired, so quiet free play or screen time was allowed, as well as helping school-age children with homework. And during overnight care, really what the focus was getting children ready for bed, helping them with any emotional support overnight as they woke up. And then during weekend care, again, there was a big focus on free play, but they were also allowed to do more trips, outings, and events that weren't typical during weekday care, where there was more kids. And also they would be integrated into family routines for home-based providers. And overall, across all of the schedules, we found that providers were including personal care routines, such as brushing children's teeth, combing or brushing their hair, giving children baths, and helping them get dressed for the day or for bed. So this was really a difference in comparison to standard hour care. In our next slide, we compared the personal care routines by provider type to see if there were any differences, and we found that FFN providers were generally more likely to incorporate these types of routines compared to FCC and center providers. So in this example from evening care, we can see that 58% of FFN providers, the bars in blue, were giving children a bath during evening care, but only 8% of centers and 11% of FCCs did so. And they were also more likely to report getting children dressed for bed, having them brush or comb their hair, and also brushing their teeth. And we did look at whether this was specifically true only for relative or non-relative FFN providers, and we found that it was more common for relatives to report bathing and dressing children during early morning and evening care. Next slide. Another interesting finding was that overall, providers report fewer children during non-traditional hours, and this was true for both FFN and FCC providers. So if we look at the orange chart here, this is the percentage of FCC providers by number of children served. So the darker bar shows those providers that serve 6 or more children, and the leftmost bar is standard hour care. So 97% of FCC providers report caring for 6 or more children during standard hours, but this was rarely the case during the non-traditional hours, the most being 26% during evening care. So there's definitely fewer children in care during non-traditional hours. And similarly for FFN providers, the darker blues show those that have 4 or more children or 6 or more children, and about 50% of them had 4 or more children during standard hours, but that was, again, a lot less likely during the other hours. In our next slide, we also see that this was also the case for center providers who also report caring for fewer children. About 94% report caring for more than 20 children during standard hours, but this was rarely the case during the non-traditional hours. And in fact, 0% of providers care for more than 20 children during overnight care. One of the things that providers report was that they were able to combine classrooms, have calmer environments, and offer more individualized care due to having fewer children present. We can go to the next slide. Now I'll highlight some of the provider experiences and challenges in offering non-traditional hour childcare. We asked providers why they offer non-traditional hour childcare, and interestingly, 95% said that they did so because families needed care during these hours, and only a quarter of providers did so to increase their income, and few providers shared that they actually like or prefer to work these hours. And when we asked them an open-ended question about what the top things they like about working these hours, if we could move forward in the animation, providers shared that they enjoyed helping working families who need this care, providing safe environments for children. They enjoyed having fewer children in care since they were able to offer them more one-on-one attention. And they also enjoyed caring for children and spending time with a related child if they were an FFN provider. And then we can go to the next slide. And despite their motivations for offering this care, many providers reported challenges with non-traditional hour care, which included long work hours that left little time for their own needs or the needs of their family, and also challenges with finding staff, lack of parent communication, and burdensome licensing requirements. We asked providers specifically about which licensing requirements they felt were burdensome, and they shared with us, if we could hit the animation here, 25% of FCCs and 11% of centers felt that the requirements were burdensome. Since a lot of requirements are designed for standard hour care, they were a little bit more challenging for them to meet these requirements during non-traditional hours. And they specifically mentioned that limits on the number and ages of children that they can serve without additional staff was particularly challenging when they had much fewer children in care during these hours, and sometimes it was very unprofitable to have a high number of staff or match the staff to child ratios per licensing regulations. And also supervising children throughout the night during overnight care was also a challenge for some providers. In our next slide, our next section is how can we increase the supply of non-traditional hour care? So we did also ask providers about expenses, and 45% of providers shared that they had increased expenses during non-traditional hours. For centers, their top expenses reported by about 60% of them were increased administration time to manage the scheduling of children and staff, and also the hiring of additional staff. However, for homes, their top expenses tended to be for additional meals and additional equipment, such as linens, beds, and toys for children. So they had different costs, but they are all sharing that they have increased costs during these hours. Next slide. So in this next section, we'll talk about how might we be able to increase the supply of non-traditional hour childcare based on our findings. So first we asked providers whether or not they would be interested in offering non-traditional hour childcare in the future. So these were providers who did not currently offer non-traditional hours, and we found that overall FFN providers were most likely to express interest in offering this care compared to centers and FCCs. Next slide. And we also asked providers why they don't offer this. So this was, again, the group of providers that aren't currently offering non-traditional hours were asked what were the reasons that they don't offer this. And some of the top challenges were staffing challenges, which were reported by 82% of center directors. Lack of time was a big issue for home-based providers. So 71% of FCCs felt that they didn't have enough time. They were already working full-time standard hours, and offering any additional hours would conflict with their personal or family time, and this was also the case for 30% of FFN providers. Increased stress was another variable that came up, although it was more common for FCCs and centers, where about half of them said increased stress would be a factor, and only 12% of FFNs felt this was the case. And then across provider types, they shared that insufficient demand was an issue for them due to fluctuating parent need, or also not having a parent that currently needed the care. And also lack of profitability. Providers felt that it wasn't profitable to offer this care. There were fewer children that need this care in general, and also they're not receiving great pay. So if there's fewer children in general, it just made it less worthwhile to offer this, especially considering the additional stress and time that it takes. We can go to the next slide. We did ask providers what might motivate them to offer this care, and they had different responses depending on their provider type. So center directors said having staff willing to work these hours, increased demand, and higher pay would encourage them to offer non-traditional hour childcare in the future. And for FCC providers and FFN providers, higher pay was the top incentive. However, a third of these providers that didn't offer it said that nothing would really encourage them to offer it, and they just weren't going to consider it. Next slide. I don't know if it's frozen. I don't see the next slide. Oh, there you go. So additional supports for providers. Oh, can we go back to the additional supports? Thank you. So we asked providers what additional supports or resources would be helpful. So this was asked of those providers who are currently offering it. And they shared that creative activities would be a helpful resource for them. So it was difficult for them when they were combining age groups to think of appropriate activities that they could do with children of multiple ages, and also activities for school-age children, since many evening providers were caring for school-age children. They also shared that they would appreciate training specific to non-traditional hour routines, how to support children's hygiene and safe sleep practices. And additionally, they shared increased funding to support their wages, to raise staff salaries, and cover additional expenses would be a very useful resource for them. And lastly, they also shared that administrative training and support would be helpful. So they would like some guidance on how to set and adjust their fees for non-traditional hours, support with creating schedules, and training on managing relationships with parents. And overall, 21 of providers who were currently offering non-traditional hour childcare said that they had completed any training specific to non-traditional hours. So overall, there does not seem to be a whole lot of training available for these providers. Next slide. So overall, our findings highlighted several possibilities that policymakers can explore to support providers who are offering this care and potentially help increase the supply of care during non-traditional hours. So overall, providers report that non-traditional hour childcare is not worthwhile because of low demand, low pay, and additional costs and stress. So paying providers a premium, possibly through increasing the CCAP reimbursement rate for non-traditional hours, could encourage providers to offer it and allow them to offer it while reducing their overall hours worked. And additionally, increasing compensation for childcare staff could enable more programs to offer it and enable some to hire assistants to help them during these hours. That might make it a little bit easier for them as well. Another thing that we could do is to strengthen support for FFN providers. For FFN providers that serve the most children during these hours, they do face some challenges to offering non-traditional hour care, such as stricter federal and state regulations that have unintendedly reduced their participation and their access to subsidies. If we could adjust federal requirements for FFN care, we may be able to increase their participation, but also increasing pay through CCAP reimbursement rates for FFN providers could help encourage them to offer it. Also, minimizing barriers. So providers shared that there were some burdens with licensing challenges that were designed for standard hours that were more difficult for them during non-traditional hours. So if we could look at these licensing regulations and see if they're appropriate or how they could be adjusted for non-traditional hours, that could be a benefit for them, as well as potentially looking into how we can improve the referral process so that parents that need this care can be connected with providers that are willing to offer this care and help solve that demand issue that they are sharing they have. And then lastly, providing additional training and resources, specifically around creative activities and training specific to non-traditional hours could be beneficial for these providers as well. That is the last slide, so I'll open up the space for any questions if there are any.
And we'll be sharing the slides as well too, so yeah, don't feel like you won't see these slides again. But yeah, if there's any questions, please feel free to come off mute. We'll open space for a few minutes. Yeah. All right, I don't see anyone come. Oh, there is a question from Rachel. So the non-traditional hour providers providing 14 hours days for CCAP families are paid the same day rate as a provider caring for CCAP families for 8 hours?
I could actually help with that if
Yeah.
you need
Yeah.
help.
Chris, come on board.
Yeah, those provide if it's over 12 hours of care, providers do get a little bit more. It's basically a full-time day plus a part-time day of reimbursement. So there is care above 12 hours is reimbursed at a higher rate through the Child Care Assistance Program, so long as the parent's activity bears out that time requirement.
Thanks, Chris. You're officially part of Fall into Action now.
Gotcha.
All right. I don't see any other questions in the chat. I know is we've been going through a lot of information, so I want to give you all a 3 to 5 minute break so that you guys can get water, or just stand up and stretch. And then we will come back at 12:45, and then we'll go into our second half of our Fall into Action, where we're going to talk about a lot of work that we've been doing with the Department of Early Childhood. So, yeah. Go get off camera if you guys want to, and take a few minutes to do a quick break, and then we'll see you guys in 4 minutes. Thank you all.
Don't say all the things we might regret. Don't kiss anymore. Both trying to keep it clean on the cutting floor. Too young to believe in. All here, we moved to New York. We found a little rental near a sweet little school. Now I'm looking at houses with 4 or 5 floors, and you found this brownstone, said you want it, it's yours. So we went ahead and you bought it. Promised not to talk about it. Then we couldn't afford it. We couldn't afford it. We could never afford this. You pushing your shoulder. Things you don't want, things you don't want. Woke up and stood. I put the key in the door. Then I moved and started ringing. Something was at the door. And they were like, hey, you got the lead in the page. You got to be back in London for a hustles in May. And later that evening, I said, how was my day? I said, I got some good news. I don't believe you play. That's when your demeanor started to change. You said, I have the position. I said, you're deranged. And I thought, I thought that was quite strange. So I thought that was quite strange.
All right. Hopefully people didn't mind the music. We were trying to get a little music going to get everyone back into the swing of things and not have total silence. So we'll get the music thing figured out one of these days, but I want to give you guys that. So yeah, if everyone just slowly come back, that would be great, and then we can start the second half of our Fall into Action. So I'll give it another 30-45 seconds and then hand it over to Bree and Angela to talk about some of the work that we at Illinois Action for Children have been doing with IDAC on some of the FFN work. All right, Angela and Bree, whenever you guys are ready.
All right, thank you, Michael. Hi, everybody. Angela Farwig again. I am here today to share, I do have a couple of slides, just wanted to share sort of a big picture update on what is going on with our new Illinois Department of Early Childhood. This agency is also referred to as IDEC. So we love our acronyms and our shortcuts in early childhood. So I may use the term IDEC to refer to this new state level department. This agency will be overseeing early childhood services and programs in our state. And we know that there's just a lot happening in terms of this new agency getting up and running. So I wanted to take a few minutes to share some key updates and information with you all today. So stay on this slide and I'll go over those updates. So for those who joined us last year, you might remember that we heard from Ann Whalen, who is the Chief Transition Design Officer for IDEC. And she talked about the goals for the new agency and the redesign process that they would be launching. And since that time, there's been quite a few developments, and we tried to highlight some of those changes and developments on this slide. And so some of those milestones and priorities include the appointment of Dr. Teresa Ramos as the secretary of IDEC and hiring of agency staff. Lots of planning underway to transition programs and services from the 3 state agencies that are currently administering the programs listed on the screen to IDEC. These programs and services include the Child Care Assistance Program, Early Intervention, Home Visiting, Child Care Licensing, and Early Childhood Block Grant programs. The infant and early childhood mental health work that our state does will also be administered by IDEC. And while most activities for this transition, and there are a lot of activities, are on track, the department has shared that they are preparing in case things fall off track. So while the plan is for all programs that are listed to shift over on July 1st, 2026, there could potentially be a delay. And so IDEC has stated that they will officially announce any delay in this transition in January. So we will be sharing with our networks as soon as we know more, but for now, everything is on track, is what they have messaged to us and to the field, and we will let you know in January what we hear. Going to the next slide. So just wanted to share a little bit about some of the high-level goals and priority areas. The new department has shared that their North Star, the big goal that they're working towards, is being on a path for Illinois to be the best state in the country for young children and families. And how are we going to do this in Illinois? By making early childhood services less burdensome, more efficient, and equitable for all. So to start this work, the Illinois Department of Early Childhood has shared some initial redesign priorities. So these are areas that they're focusing on as they transition to administering programs and services. And there are 5 areas that they have identified as focusing on first. And those are listed here. Aligned programs and standards, data, 0 to 3 services, licensing and regulatory processes, and aligned funding streams. So each of these priority areas have their own set of efforts and work underway, and we can't cover it all today, but we will be diving more into the funding area a bit more. But I just want to share, please reach out to us, anyone on this call from Illinois Action for Children anytime, and we'd be happy to take a deeper dive into any of these areas with you. And one last thing I wanted to note for the group is that IDEC is really starting this work with families. They want to engage families to learn what they want and need from our early childhood system in Illinois, and then identify what early childhood providers need to deliver that to families. So that's sort of the overarching process that the new department is using. We can go to the next slide. So here at Illinois Action for Children, we really know that engaging families who are juggling so many things is really difficult work. It can take time, it takes dedication, it takes trust. And so we are very deeply appreciative of IDEC's commitment to starting with family wants and needs in this redesign process. And we definitely applaud them for all their efforts in this work. But we know, and the folks on this call know, that this work never stops and can always be improved upon. And right now, in this moment that we're living in, it feels really important to think about how we're reaching families. So when we get through our presentation, we'll open it up and we want to hear a little bit more from you if you want to share today or follow up about how you're engaging families and ideas for how IDEC can continue to engage families in this work. So like I said, we will take a brief pause and we can talk it out, or if you want to throw some ideas in the chat, we'd love to see those. We are also here at IAFC deeply committed to elevating parents as leaders and continuing to advocate for parents to have a table at the state level to support their leadership and policymaking. And this work is building from our work with the Family Advisory Committee of the state's Early Learning Council, as well as work we led with a subsequent group, the Family Engagement Work Group. And so if you want to hear more about this particular part of our work, we would love to talk with you more. Please reach out to us or our partners in this work, Kofi, and we can definitely share more about that. Finally, Illinois Action for Children is committed to ensuring that parents can find the childcare that meets their wants, needs, and preferences. And that means we here at IAFC want to be sure that center and home-based options are available for families and that all providers are integrated and supported in this new agency. And so as we learned more about the priorities for the new Department of Early Childhood, we knew that funding work is critical to ensuring that all early childhood providers have the resources they need to provide the quality care families want. So we have really leaned into this work, including making sure that family friend and neighbor care, a vital part of our childcare infrastructure here in Illinois, is a part of the conversation and is really elevated as a priority for the new department. And so that's what we're going to dive into a bit more today. Stay with us. And so I'm going to turn it over to Bree Stormer, who's going to share more about this work.
Sure. And can we go to the next slide? Thanks, Angela. So I'm going to share a bit about how Illinois Action for Children has been engaging and sharing feedback with IDEC on what FFN care could look like in a redesigned funding model. But to do that, we really need to tee up what is funding redesign and what has been recommended so far. So we're going to kind of start there. So what is funding redesign? I don't hear those words and immediately kind of picture something or understand something. So I think it's good to kind of break down the different components. So we know that in early childhood, in early learning and care, there are a lot of different funding streams that folks are drawing down in order to make their programs work. In the slide, we have shared some of the care and learning funding streams: CCAP, Preschool for All, Prevention Initiative, Head Start, Smart Start Workforce Grants. But if you're doing home visiting, or if you are working with EI providers, you may be using even more funding streams. There's a lot of different funding streams. And we know that that's not all going out equitably. We know that the amounts aren't quite enough. We know that the ways that they go out are different. The applications are different. What you do with them are different. And that makes it really hard to provide sort of streamlined care across the state. And so what IDEC is doing is they're convening a funding design work group, and they've convened several subcommittees as well to look at a couple of different components of funding design. The first is alignment, and that's sort of reducing the overall number of funding streams by combining funding streams that currently exist, so that there's, rather than 17, maybe there's 4. That's kind of where they are with it right now. Distribution, so that's actually how you apply for and get that funding, with the goal of really improving stability and predictability. And then what they call adequacy, or you'll also hear true cost of care. So we know that kind of regardless of what funding you're pulling down, what combination of funding, folks don't have enough to do what they really need to do. Funding is insufficient to really meet the needs of different populations. And so they want to understand what it costs to provide different kinds of care in different settings, in different regions, at different times of day, with children and family of varying needs. So big, big project. So if we can go to the next slide. So what have they come up with so far? They convened a subcommittee on alignment, and they convened a subcommittee on distribution, and they developed some preliminary recommendations about what this could look like. So the alignment subcommittee really looked at different funding streams and said what could be combined. And they looked at a bunch of different things, and they ultimately said, okay, we think we can combine childcare and pre-K, which includes infant toddler. The name is a little misleading, but sort of childcare as in CCAP, pre-K as in some of our pre-K funding. So that's really CCAP, Early Childhood Block Grant, Preschool for All, and Preschool for All expansion, Early Childhood Block Grant, Prevention Initiative, center-based. Smart Start Workforce Grants, and Smart Start Quality Support Grants. So instead of that being a bunch of different kinds of funding you draw down, that is one funding stream. Home visiting, looking at McV, MCHV, IDHS home visiting, and Prevention Initiative home visiting. And then with distribution, they're really looking at the ways that the funding comes to you. So they looked at a couple of different models and they said, okay, competitive grants, we're using them right now for early childhood block grant. That hasn't always been super equitable. We think we should only really use that for startup or pilot funding, and move more things into non-competitive grants. So that's really thinking more like what Smart Start Workforce Grants is, or CCAP site-based contracts. You apply and you're allotted a certain amount of slots, a certain amount of funding, and it's really designed to be stable and multi-year so that you know what to expect. They are still maintaining CCAP vouchers for some families and providers that might not want or be ready to access multi-year grants. And then keeping what they call payee agreements for early intervention, because that's a legal requirement of early intervention. So Illinois Action for Children looked at all of this, and we've been engaging on a number of issues here, but we really saw family, friend, and neighbor care as something that needed special attention and special focus here. Because family, friend, and neighbor care is not drawing down all this different kind of funding. They're really only drawing down CCAP. We were looking, okay, maybe they keep vouchers, but what if they want to build into the system? What if they maybe want to become licensed? What if they want to improve quality? What should that look like? And we know that that's such a critical portion of our sector, partially, what Alejandra shared about them being more willing and more able to provide non-traditional hour care, their ability to serve children with disabilities. All of those things are so important. And we also know that a system that works for our smallest providers, for our FFN providers, really, if you start there and you build from there, you're going to have a system that works well for everyone. And so we wanted to take a specific look at FFN care and make some recommendations to IDEC. And so the first set of recommendations we made was around funding distribution. And that we said, yes, definitely retain vouchers for FFN providers, but don't just do that. Also create pathways that would allow FFN providers to access multi-year non-competitive funding, just like all the other providers who are interested in doing that. So how do they do that? How do they access that? We said, okay, well, you could use the competitive funding opportunities, the pilot programs, the startup funds that you were talking about for other providers to pilot quality supports for FFN providers that could help them access this funding and or help them get licensed. We know that that's a barrier to folks getting licensed. And so letting people access that multi-year funding or licensing or both. We also said, and this is across the board, we really want to see those CCAP vouchers paid prospectively and based on enrollment. That did come out as federal guidance a couple years back. And we really want to see that implemented for FFN providers as well as across the board. Next slide. Oh, can we go to the next? Oh, there we go. Sorry. I think it was just a little bit behind. So we also made some recommendations around adequacy. What does it actually cost to take care of children in an FFN setting? One of the first things we said is that IDEC should create a reimbursement model for FFN that accounts for the cost of quality care plus a baseline salary of at least minimum wage when caring for two full-time CCAP children. So right now, an FFN provider who is caring for two full-time CCAP children is making sub-minimum wage. We think at least minimum wage and then accounting for quality care. We also want to see an increase in FFN health and safety improvement funds with inflation adjustments. We know that those costs are going up, and so we want to see inflation adjustments, obviously not just here across the board, but really being conscientious of the fact that that needs to go up. And lastly, we know that the Gateways training tier add-on utilization among these providers is low. And so we think if the percentage was increased, we would see an increase in participation. So we want to incentivize participation. We want to make it easier for FFN providers to provide this really critical care. And so these are some of the ways we think we could move towards adequacy. So if we can go to the next slide. So the very last piece of this is next steps. And so there are currently subcommittees that are convening to answer this question around what is true cost of care, what is funding adequacy across these different settings, across the different families served. And so if you're drawing down any of this funding, really strongly encourage you to engage in this work because you have something really important to share. So there are three types, three subcommittees. Two are currently convening. One is starting soon. Childcare pre-K, that's all of those CCAP, Smart Start, ECBG, Head Start, all of those, home visiting, and then family, friend, and neighbor. And so I can post the IDEC events calendar in the chat. It's really worth it to participate, to share your feedback, because it really does matter. They need to know how much it costs to provide this care so that, that when they develop their funding models, it's built with all kinds of care in mind. So one more slide, I think. Okay. So we are going into a large group discussion, and I would maybe turn to Michael to ask how much time we have to engage in this discussion. I know we're just a couple minutes behind.
Yeah, thanks, Bree, and thanks, Angela, for awesome information. So like Bree said, we're gonna do a bigger group, large discussion group. So we have time. I think this is very important to hear from you all on some of the work that's been going on. So we'll definitely carve out at least 5 to 8 minutes for this, and then yeah. So we would love to hear from you all. Please come off mute or put in the chat any conversation or questions that you might have.
And just we'd love to hear any questions or thoughts you have. We did put 2 prompts on here, just thinking a little bit about what we highlighted with the work with Illinois Department of Early Childhood. Would love to hear any thoughts around family engagement, family voice, how, if you participated in some of this work, do you have thoughts to share or do you have ideas? We'd love to pass those along. And then again, just thinking about the funding design work, we know it's I can't even think of the right word. It's sort of technical and it's a lot and it's important. So we're really trying to make sure we're sharing that with the field so that you all are informed about what's potentially coming. So just really want to hear from folks. If anybody wants to come off mute or just put a question in the chat, we'd appreciate it.
Yeah, and knowing that that's technical, clarifying questions too. Oh yeah, go ahead, Kimberly.
Yeah, I just wanted to comment. Number one, thank you guys for the amazing job you're doing and keeping everything very cohesive, and just the outreach is amazing. So just really, really grateful from a provider standpoint that you are so actively involved in meetings like this take place. And just for all of those who are really learning just learning about this or starting these processes, just want to encourage everybody to really dive in and participate and make sure that your voice is heard, because they are listening, and this is a very unique opportunity that we have. So just to really encourage people to do that and jump into these meetings, even in a listening, potentially listening, and then being able to participate moving forward. So again, thanks for everything you guys are doing. Looking forward to these next sets of discussion.
Thanks, Kimberly.
Thank you, Kimberly. Y'all are stretching dollars in amazing ways at the programmatic level that IDEC really needs to hear about and understand, because that's ultimately going to improve the way that they design this funding to make sure it's really serving your needs. So just echoing everything Kimberly said.
All right, I'll leave it open for a little bit longer. Again, yeah, don't be shy. Come off mute or put in the chat. We definitely have some time for discussion. So yeah, I'll leave it open for a little bit longer. If not, then we will go into our last portion of our webinar and go into some of our smaller discussion around some workforce priorities that we are looking to get some input and thoughts from you all as well. So I'll give it another minute or so, just in case people have something pressing that they want to provide or share.
I have a question.
Yes.
Is there any data on how many families are looking for non-traditional hour care and have not been able to find it? Do we have the data?
I can answer that question.
Sandra.
So our partners at University of Chicago are working on a parent survey currently. So we are going to be doing that analysis and we want to understand more so the demand side of it. So that research is in progress. But here at Action, we did the provider survey. So right now we have sort of the supply side of it.
Thank you.
Mhm.
Nicole, I see your comment/question in the chat. So when gathering provider feedback on different topics in my region, FFN providers are saying that they are not able to receive grants, including ECA's grants, and this is upsetting to them. Can you share a little bit more on that, or was that just a statement that you just
Yeah,
had?
I was simply making a statement about the we talked to providers about many different topics within Birth to Five Illinois, and I know family, friend, neighbors who provide care. That's most upsetting to them is that because they're not licensed, they get excluded from a lot of the grants.
Yeah, Nicole, I appreciate that comment, and I know that that is something we've heard as well. And I think, I think that what we're seeking to do with these recommendations is one, increase access by way of some of that competitive funding for pilots for things like that to help folks professionalize, to help folks get increased add-ons. Thinking about, that CCAP piece too, how could that be increased or supported for if they're providing support to children with disabilities, for if they're providing that non-traditional hour care, and then really supporting them towards licensure so that they can access the full range of grants. But I'll also say that once this FFN subcommittee is up and running, those folks should really go into that space and talk about that, because I think that that's something, when we talk about adequacy, when we talk about true cost of care, okay, well, if FFN folks are trying to professionalize as part of the incumbent workforce and they're not being seen as that for access to ECAs, if they're not being seen as that for access to some of these other things, what does that ultimately mean for that sector being able to sort of increase their capacity to provide care and increase quality? And so that's something we should definitely, I would definitely encourage the folks who you have spoken to speak up in this space, because this is an opportunity to share that feedback directly with IDAC once that subcommittee is up and running.
Thanks, Bree, and yeah, thanks everyone for the great questions. We are now going to move over to our small breakout group discussions. So Aman, if you could go to the next 2 slides, I believe.
One more.
Yeah.
Oh.
All right, so Crystal, you want to go ahead and share out?
Sure. So we will now be going into our smaller breakout rooms. So you'll be auto-assigned to a breakout room. There'll be a little button that appears in your screen that you can either click join, or it'll automatically send you to the breakout room. In this breakout room, we will be discussing this question. So as the Department of Early Childhood begins to assume all child care responsibilities by July 2026, one area of focus will be workforce development. Recruiting and retaining qualified child care educators continues to be difficult. What are some of the greatest needs you see for the current workforce? Is it compensation or benefits, credentials? What other parts of the workforce needs more attention and focus? So like I said, we will now be breaking into our smaller breakout rooms where we'll be able to discuss this and anything else that was concerning to you or that you wanted to discuss from the presentation.
And don't feel like these are the only 3 things that you guys can talk about. Obviously, there's a lot of other things that the Illinois Department of Early Childhood focus on when it comes to workforce development. So don't feel that this is the only three areas that you need to discuss. So feel free to expand and go further. So Aman, if you can get us into breakout rooms, that'd be great. And then
and public action. We want to make sure that more families, educators, and community leaders can join and take part in this work. So to that end, we're going to ask you to do a little something right now, which is to take action. Let's go to the next slide, please, Aman.
What more, Aman?
Okay, you know what? That's okay. Let's just skip right to the chase. I'm going to drop into the chat an opportunity for folks to take action right now. And I urge you to do so when you have time. Maybe cut and paste what I'm about to drop into the chat right now. Actually, Celia is going to drop into the chat right now. I appreciate that, Celia. We are collecting and posting testimony for fiscal year. So in FY27, which was last year's legislative funding effort, budget funding effort, a lot of the programs are flat funded. And we have been collecting information, stories about the impacts of this flat funding on folks across the state. This includes ECA's funding, early intervention funding, home visiting, ECBG impacts. And so we would like to hear from you. We hope to use some of these stories and some of this testimony to substantiate our advocacy for FY27 for this coming year to help ensure that advocates have centers, providers, and families have what they need. And so to that end, in the chat is being dropped information. We ask you to click on the link and share your story. Share how you've been impacted. Share how cuts to programs or flat funding to program has impacted your ability to be able to do your work effectively, and share what you need moving forward for the coming fiscal year. And so to that end, that has been dropped in the chat. I urge you to take a look. Our next meeting is coming up on Thursday, December 4th at 6 p.m. We urge you to join us. It's an excellent opportunity for you to learn a bit more about what's happening in the field, what's happening with regard to federal issues, what's happening with regard to state issues, and an opportunity to share information that you're experiencing as well. So again, this information is being dropped into the chat. I appreciate the time for y'all to come and hear about what we're doing, and I'm going to move it over back to Michael. Thank you, Michael. I hope that was fast.
Thanks, Emma. Perfect. We have a minute left, and I'm gonna take that minute to close us out. Aman, if you can go to the last slide. Yeah, one more. Yeah, there we go. So again, thank you all for taking the time out of your busy day to join us. We just want to give you some opportunities for you to stay connected, sign up for We the Village and some of our coalition meetings, and then, just continue to be vigilant and to be doing great work that you guys are all doing. We know that it is a very tough and stressful time for many of us, and especially in Illinois and around Chicago area land. So, we're all here to provide assistance or provide help. So hopefully you can lean on us to for any help that you might need as you continue to do some amazing work in serving our children in the state of Illinois. So with that said, it's 1:30. I'm gonna give you guys respect everyone's time and end our Fall into Action for 2025. So thank you all and have a great rest of the day. And hopefully this was the best 2 hours of your day today at least. So thank you all and have a great week.
Bye, everyone. Thank you.
Thanks.